Hello everyone, this is Dr. Tran, and I just want to introduce you guys to some of the things that nutritional stuff that we do on the side, because sometimes we're too busy to let you know all the supplements we've been carrying. But first, let me introduce you the vitamin company that we've been working with for the last 15 years is Biotic Research. It's owned by, I think, chiropractor founded. And the reason why I've been using them because they are very high quality and they constantly do new research, and they only sell to medical offices. And because of the quality, the price are slightly higher than what you buy over the counter. But I believe you pay for what you get. And people ask me all the time, what is a good vitamin? I think there's a ton of good vitamins out there, but I only recommend the one that I know, and I know this one. So because my family had been using it, all my patients have been using it, I personally use it every day, my children using it. So why do we need vitamins? Well, I might have talked about it several times, but one of the things that I think I haven't mentioned is think about if you have to renovate a house. Like right now, I have my bathroom is being renovated at home. While the workers do the demolitions, the owner went and ordered a supply. He went and buy ties and lightings and all that. Same thing with our body. Over time, every day we have wear and tear, or we have damage in our body, and we expect the body to heal itself. But think like this, can you do renovation without all the supply? Buy new tire, buy new paint. We don't give your body extra when you get sick. And I'm not talking about physically sick. I'm not talking about, pull a muscle, hurt the back, or sprain a muscle, strain something. Just like say if you get a cold, right? After you recover from the cold, your body uses quite a bit of energy to fight off whatever infection you have. But afterward, do you ever give your body back what it takes to do all the fighting? If you don't, that means you're taking away your saving. And you wonder why, as you get older, you get weaker and then you don't recover as fast. You don't recuperating as fast. We just don't have the raw material saving for the body to do what it's supposed to do. And that's why over the years, the reason why I add this to my treatment plan to all my patients is it's just simple. It's not about whether you want to take these supplements. It's not a choice, especially a lot of the problem we deal with are chronic. Your spinal joint are designed to last a lifetime, 80 to 100 years. But we wasn't designed to do all the sitting and stationary like we are right now. Imagine when you sit on a computer, you're holding the phone like this all day long. The muscle is working in the back, it's holding you up all day long. So back in the day when we were hunting and gathering, we don't use the muscle that much. And every single time you use any muscle in your body, lactic acid will build up. And at night, your body has to get rid of those. But to neutralize lactic acid, you need to have oxygen and you need to have electrolyte. But let's say nowadays, where do you get those electrolytes from? Our water doesn't come from the soil much anymore. Our water are recycled. So recycled water meaning they go to a clean facility, they usually disinfect it with chlorines and other stuff, but there's no mineral added to it. So every day our water sources get less and less nutrients, more toxic stuff. And then our vegetation. Most of our vegetables are not local grow anymore. Most of them import 1,000 miles away. So by the time they get to you, most of the nutrient already diminished. So by the time it gets to your table or our kitchen, there's not much in it. And that's why we have to eat a lot more than we're supposed to, because we don't get what your body needed it. So that's where the supplement come in. And let's say we talked about chronic disease earlier. Most people have back and neck and shoulder pain or any joint pain. It's years and years of wear and tear. So if you don't have enough supplements for the body, some raw material like chondrosamines, multiminerals, for the body to use, your muscle tightness cannot be unlocked. The way the muscle works is you need energy to turn the muscle. That's how you contract the muscle. But to unwire that process, you need to have calcium, magnesium, and potassium. And calcium is being used all over the body, all the cells in the body, not just for bone. Because most people, when you hear calcium, you only think about bone. That's not the only thing. The bone is where they store, but they need for everyday uses. So when you don't have enough, what happened? Let's say 10 muscle contract, 10 fiber contract, only 5 relax. What happened? Every day you have extra tightness. That's why you have all this trigger point. You have a big knot here, big knot here. I can guarantee I can take any of you there and I can palpate and I find trigger point, I find pain, I find tendonitis. Because your body just doesn't have enough time to clean out the trash we put into the body. So this is help your body heal. So when you get treatment, after you play sport, after you exert your body too much, you need to have this guy. So these are some of the basics. It looked like a lot, but there's for different thing. So let me introduce you one by one, and hopefully some of these might be beneficial to you. Because more often than not, I'm too busy to mention some of these, and you might not even know that we have this stuff. But the biggest tub in here is called prenatal vitamins, okay? It's called prenatal vitamins. It's designed for pregnant women. It helps, with women's health. But just because prenatal doesn't mean you have to be pregnant. It's prenatal meaning it's safe for pregnant women, meaning any woman can take it. We have most female patients here take it. It's a multivitamin for a pregnant woman. That's what it is, okay? And it's in a big jug because it came with 60 packs. And you have to take 2 packs a day. And yes, it sounds a lot, but think about it, if you have children, after you give birth to the baby, they took a ton of stuff from your body. You have to give your body back what you took from it. So this helps replenish them, okay? And don't forget, prenatal is just not only for you to get ready to get pregnant. Afterward, years and years later, your body still needs this stuff. So this prenatal vitamins, okay? And usually prenatal, we also talk about bio-omega-3, and I already have quite a few videos on this one. It's extremely important for the brain, for the heart, for the artery, for the vein, for your skin, for your joint. It's a great, wonderful natural anti-inflammatory. It's the only thing that can cross your brain barrier. That's why it really helps with stress, brain-related issues. So that's prenatal, this bio-omega-3. And like I usually say, the most important thing here is the level of EPA and DHA. So that's bio-omega 1000. The next one that I recommend, very common all the time, is called BioCMP. This stands for calcium, magnesium, and potassium. Or in another word, it's electrolyte for the body. Earlier I said when the muscle contracts, you have to have energy. To relax, to unlock the muscle, you need to have these things. So that's BioCMP. And for women, I usually recommend, instead of BioCMP, I recommend molten mineral. So it's similar, it had also calcium, magnesium, but it had other stuff like zinc, selenium, copper, manganese, chromium as well. And some of them have iron, some of them doesn't. But I highly recommend this for all women to take. And then when we have so when we talk about electrolyte, we have also the powder form. For those of you who do not take like the tablet capsule, this is also daily use of electrolyte. They just came out with these products like last year. And I use it too. You just put it in the water, your daily water bottle, and just shake it up and drink it 1 or 2 times a day. And remember, just like you're making money, right? The more you spend, the more you have to make. So the more active you are, the more stressed you are, the more your body needs this thing. And when you take this thing, I heard complain all the time. I say, oh doc, I can't take 10 a day, I can take 5 a day. Just think if you drive, 10,000 miles in every 3 months, how often you change your oil? It's not what you want, it's what your body needed. So if you stress out more, you work out more, you change your activity to more active, you need to take more. And even if you passively, you sit in a computer for the last 20, 30 years, your back has tremendous amount of lactic acid build up. If you have somebody palpate your muscle, it's tight like a rock when you're relaxing, that's a sign your body's severely deficient of these guys. Because people ask me all the time, Dr. Tran, how much should I take? Well, how many years have you been using your body without, proper nutrients? And if you have enough, your body shouldn't be that tight. And yes, you cannot just release everything in at one time because your body can't take all that. But you have to make up for it. Just like you take a loan to buy a house, right? You pay it off in 30 years, right? So let's say the first 20 years of your life, you take away a lot from your body. You better pay them off slowly so that by the time you retire, hopefully you pay up your debt, so then you have extra health then. So then let's talk about the other amazing thing is Active Max is magnesium powder. Now, before COVID, I didn't pay a lot of attention to this. However, after COVID, I had a tremendous interest in this because several of my friends who had issue with fogginess and unable to think and concentrate after they get infected by COVID, this make a huge difference. Just after 1 week of using it, her concentration was improved, her fogginess was gone away. So magnesium, they have over 500 uses in the body. And I'm not gonna go into detail in this video because it's just briefly explanation to all the one we use. But if you're interested, look it up or let us know, we make another video for you. But it's give you a tremendous amount of benefit, and it improves your energy level as well as your ability to concentrate. Same thing, it came in about a powder form and just 1 scoop or 2 scoops a day depending on your need. And then let's go to so we talk about the mineral, now we talk about multivitamin. So this is multivitamin for women. We have something called BioMulti+, which is multivitamin for men. And remember, you cannot have once a day because it doesn't work like that. Because depending on your size, depending on your need, everybody needs it differently. So most of our vitamins, you have to take at least 2 or 3 a day. Just like you take 1 or 2 meals a day or 3 meals a day. And then when you talk about the muscle, you cannot live out the joint. So we have something called Chondrosamine Plus. It's a form of nutrient that help the joint, the cartilage, absorb more fluid. So in here they have vitamins, chondroitin sulfate, MSM, and so basically this is joint support. So all of my patients take this. And remember, these we consider these food. So we eat this technically. So yes, if you need to take 10 a day, different one, you do it. So that's for the joint. We have muscle, we have joint. We have this for energy. Now, one of the other thing that I think that most of us heard about is B12. Because people know that B12 gives you a boost of energy. So B12, but they had to be directly absorbed under your tongue. Because if you take the tablet of B12, your stomach acid destroyed it. That's why we have lozenge here that you put on your tongue and you just slowly let it absorb. So you can take 1 or 2 tablets a day, just slowly absorb. And that's why they do B12 shot. You have to go directly into your muscle, or you go through your mouth and it's just slowly absorbed in your tongue. And that's the proper way to take B12. And same thing, B12 is for brain functions. So everybody needs this. And then vitamin D, K is extremely important. My children take once every day, I take once every day. So before we only recommend vitamin D, but recently they have shown that the vitamin K helped to pull the calcium away from the artery. So that's why they have vitamin DK. And vitamin D is essential for a lot of things, for your cardiovascular health, for bone health. And I personally experienced it in the past year because I have bone graft in my jaw. I have severe bone loss. And after 4 months of taking this every day, I went back to the surgeon. He told me my bone was pretty strong. So it's just quite amazing. So if any of you have to have a problem like me, like bone loss in the jaw, and you have to have implant or you need bone graft, highly recommend taking vitamin D. Even if you don't, you need vitamin D anyway. But DK is a new trend right now, so that's important. So let's see, what else do we have here? So vitamin B complex. So over the years, when your body doesn't have enough vitamin B complex, you can have chronic pain, just overall chronic pain. So vitamin D is extremely important. All right, so B12. One of the other thing that I think we have not mentioned is a lot of us have digestive problem. The first thing that affects you when you're stressed out is your stomach. And because of when you stress, you don't eat properly, your stomach acid, came out when there's no food, and when there's food, there's not enough stomach acids because you used to burn out. Anyway, stress causes severe digestive problem because over time, and also the overuse of antibiotic can really destroy your stomach lining. So this is the probiotic Biotic 7 that really help replenish your gut. So any of you take antibiotic, highly recommend taking this. Or even if you don't, if you have digestive problem, I would recommend taking this daily anyway. It helps to replenish your stomach lining. So there you go. And then Intenzyme Forte, I give this to patients who have acute problem. Like 2 years ago, I fell off the bike and broke my elbow. I have a crack right here. And I take 30 tablets a day. Yes, 30 a day. And 3 days later, I see a huge 50%, 60% reduced on swelling in my elbow. It mainly composed of bromelain extract. Bromelain is pineapple extract, and it has quality of reduced inflammations and some enzyme. That's it. So if anybody have acute injury, muscle sprain, strained, or torn a muscle or something like that, I highly recommend this. And yes, I took 30 a day and without anything, just a regular, without food, and my stomach was completely normal. So yes, it doesn't irritate your stomach by any chance because it's supposed to reduce inflammation. So those, let's see what else we have here. All right, so let's finish talking about the stomach. One of the other things I realized is quite a few patients have GERD or the indigestive problem and heartburn. And usually what happens when you have heartburn is they usually recommend Nexium or antacids. And we think that the reason why our heart burns because we have too much acid. It doesn't work like that. Hydrochloric acid is extremely powerful, which means it's very expensive to make. And usually when we stress out, your body don't have enough to make extra. But what happened with usually the heartburn is when you eat, if you eat, eating schedule are irregular, so your body doesn't know when you're going to eat. So sometimes the stomach, when you're too hungry, the acid came out and there's no food. And then other time when you eat and there's not enough acid. So when you don't have enough acid in your stomach, it's called indigestion, which means the food stay in your stomach longer without digesting. It became gassy, and it creates bloating. And then when you have gas, what happens? You have to fart more, and so it pushed the food and the stuff up into the sphincter, towards the sphincter of the stomach. When your stomach, the food come in, they have a little sphincter that they close and open. So the stomach are designed to protect from acid environments because they have a special lining with all the good bacteria that grow in it, but the sphincter doesn't. So when acid go on and hit that part, it is actually cause damage to the sphincter, and that's where you feel the burning sensation. So a lot of time, and since you don't have enough acid in your stomach, and then you take the Nexium to neutralize the acid in the stomach, over time, first it might help you reduce the inflammation here because there's no acid to burn, but long term it actually creates problem with digestion. So actually I recommend the tablet for people who have digestive problem. So this HCl tablet is also not commonly used, but I think it should be used more for anyone that have digestive problem. So we talk about muscle, we talk about joint. Oh, and also we need to talk about tendon. So the BioCMP, one of the properties that it had is also it helped reduce tendonitis. Most of tendonitis happen because the tendon itself are very strong. It's designed to last a lifetime, right? But it's composed mostly of fibers. So the tendon is usually it's so strong, but because it's so strong, it doesn't have a lot of blood supply because it makes mostly of fiber. So when you damage the tendon, it's very hard to heal. But most of the problem from the tendon actually came from muscle tightness. Because when the muscle contracts, it's shortening, right? And if you shorten the muscle and you don't elongate it back, it put a lot of strain pulling on the tendon. And if you're constantly yanking on the tendon without the flexibility, you slowly rip the tendon out, fiber by fiber. And that's what creates tendonitis. Imagine you have two tendons, one is smooth and one is rough because of the torn. You rub on each other like that. See, that's create tendonitis. You see, so the BioCMP indirectly help reduce the muscle tensions, and in turn it helps reduce tendonitis. So yeah, tendonitis is a chronic disease, not acute, because the tendon is designed to last a very long time. So for you to injure the tendon, that means you've been rubbing and the muscle has been tight for quite some time. So that's BioCMP. So we talk about tendon, muscle, energy. Let's talk about bone. Especially a lot of lady, you tend to have, osteopenia of weak bone as you get older. Partially because if you get pregnant, if you give birth to the child, every child you have, ton of stuff are taken away from you, and you never actually replenish them. And also, your bone don't just stay strong because you're taking calcium. So Osteo B is one of those formula that they make for bone, but they're not just the calcium itself. It had different vitamins and different concoction in here that help the bone grow. But still, just because you take this doesn't guarantee your bone will be strong. Your bone will stay strong if you use them constantly. Our body is really good at adapting and saving. So anything you don't use, you lose it. It's muscle atrophy. You don't realize when you're not active, your muscle are waste away, and when your muscle are waste away, I mean you don't use it, there's no pulling on the bone also become weakening. So if you want to have strong bone, if you have issue with weakness in the bone, osteopenia, not only you have to start taking vitamin D, taking also B+, but you have to increase your activity level. And I'm not talking about walking. You have to exert some force to the bone. So like weightlifting, proper weightlifting, running, jogging, something that put strenuous, more pressure than you normally use. Because one thing about aging is we have to stop, slow down the atrophy of the body. And that includes everything from muscle, from tendon, from bone. So taking is one thing, but if your body have no demand for it, they will not make your bones stronger. And that's why I focus on my patients. Like when you go to any kind of treatment, whether you go to see a chiropractor, you work out, you see a physical therapy, you do acupunctures, you need to take this so your body can use it, especially the spinal joint. The only way your nutrient can get in your spinal joint, your spinal disc, is movement. So if your joint are locked up, there's no movement, doesn't matter what you take, it's useless. Like you order all the stuff from Amazon and they deliver in the front door and you just leave it there and never open it, it's just a waste of money. So same thing, just because you take these stuff, but if your body can't access to it, it's not useless. And that's why when you take something, your body, it's not like, okay, you take something, your body automatically go to, let's go to my ankle. No, it's go to your stomach, it goes to your bloodstream, it goes throughout your body. And that's why you have to take a lot too. Because just because you take one pill, there's maybe 50% of it might go out, to the waste system. And you might absorb half of it going to your body. And then half of it might not go to where you want it to go unless you direct it. And that's why sometimes when you receive some kind of treatment like chiropractic, acupunctures, or cupping, your body say, okay, so I'm taking this, but I need it here, in my hip, in my shoulder, my neck, and my knee. Also, I do a lot of knee work, so my knee needs that stuff. So then it delivers to the designated area. So there's a lot into nutrient, not just taking the stuff. All right, so we talk about bone, we talk about joint, we talk about energy, we talk about muscle, we talk about nerve. So the brain, so we have this for everyone, but occasionally we have children who cannot swallow the big pill. Then we have this gummy for the children. I don't highly recommend the gummy for everything else, just because sometimes we don't want to take stuff, so they make it easier for you to eat like candy. But for children, this is exceptional. So they make really good gummy for children. They don't have as much potency at the capsule itself, but they do have half of it for children. And also for those who have trouble swallowing pill, we do have a liquid vitamins. It tastes lemony, like most liquid stuff, but it doesn't taste as bad as cough syrup. But like I said, if you think it's a necessity, you do it, doesn't matter what. But it's actually pretty easy to take. So if you have trouble swallowing pill, we do have liquid form. So let's talk about sleep, because I have quite a few patients who have sleep insomnia, problem. And this company from Biotic Research, we have something called alpha, theta, ultra, BM. And a lot of our patients actually notice a big difference when they take these. So yes, we do have for sleeping, and basically they just use different type of herbal stuff comprised in here and help you relax and sleep better. And when you talk about herb, we cannot forget the booming and very popular nowadays CPD. And these are gummy. So same thing, we have patients that have good result with this, but it doesn't work for everybody. So now these should work for everybody, but the CPD, basically same thing. We have the gummy here, and then we have the liquid form. But I think it does help relax. Most of the people that use it, they actually feel that they're more relaxing. For sleeping, whether it help or not, that's a different story. Because sometimes we focus almost on the symptom. So the symptom is not sleep, it's pretty wide. You can have many reasons why you can't sleep. It could be because something going on in your mind, it's too much stress, you can't fall asleep. Or for me, I'm a very light sleeper. So I have no trouble going to sleep, but then any little thing can wake me up. So for insomnia, you definitely have to have someone to talk to figure out what the cause of your sleeping problem is. Is it you can't fall asleep, or you have to wake up and go use the bathroom more often and you can't go back to sleep? Maybe you're too exhausted too. So that's another thing about sleeping. But we do have some support for sleep in case anybody need it. And I think that should cover everything. Yes, that's cover everything. So I hope this video help to line up a little bit more understanding on the importance of supplements. It really is not a choice. It's a necessity. So when you keep past your head that, okay, these are not drug. It's not the same you're taking, Tylenol, Advil, antibiotic, or prescription medicine. It's not medicine. It's called supplement. It's micronutrient. And if we get enough, and people ask me all the time, they talk, if I eat well, so yeah, it's fine. But remember, you have to eat well for your entire life. Usually people don't eat well, when they were younger. When they get a certain age, after midlife, and they start worrying about, death or diseases, that's when you start to think about eating and dieting. But all those years that you overuse, you take everything from the body, you need to give them back. You need to replenish them. So just changing eating in the past 5 or 10 years, changing your lifestyle and changing your diet doesn't necessarily, fill up all the years of abuse you put to our body, all the thing you take away from it. And that's why they call supplement, it's additional stuff. And think about it, if you really have enough, then you shouldn't have pain, you shouldn't have soreness, you shouldn't have all this trigger point here and there, you shouldn't have tendonitis. So I'm not here to try to sell you this stuff. I'm here to tell you it is important and it's essential to take additional supplements. So once again, if you have any questions, like I said, let me know.